The name of the project is the Open Project. It's funded by Horizon 2020, and it looks at this growing movement of people living with type 1 diabetes who are building their own artificial pancreas systems through open source collaboration. So type 1 diabetes is a chronic condition whereby the pancreas stops producing insulin, which is a key hormone in the regulation of glucose. And this means that in order to manage the condition, you need to replace insulin with multiple daily injections or insulin pump therapy. So for a long time, people have looked towards the idea of an artificial pancreas to automate the process of insulin delivery. But the commercial pathways towards development has meant that the development has been slow and piecemeal. And this has been much to the frustration of people living with diabetes. So back in 2013, a group of highly tech-savvy individuals living with diabetes figured out that they could build an artificial pancreas system for themselves. And so happy were they with the results of this that they put the open source software online so that other people could build one of these systems for themselves. Then in 2018, we formed the Open Project with the goal of examining the clinical and quality of life outcomes of people using these systems. Because the issue was clinicians, they viewed this movement with a lot of skepticism because it was developed outside these commercial pathways. So we started the Open Project to help build an evidence base around the innovations that are being developed within this movement. What we found was people who are using these systems not only had huge clinical improvements, but also tremendous improvements in quality of life as well. And what we also found was that a lot of people who had perceived themselves to have a kind of a low level of IT literacy were able to build these systems themselves through the support of other people within the community. One of the things we've been able to do is to develop a consensus statement around the use of these systems in clinical settings. Our research is allowing clinicians, I suppose, to help them and reassure them of the use of these systems, that they're safe, that they are effective, and they're helping people living with diabetes.